normal body temperature is 37 degrees centigrade. It's a bit higher when measured in the ear and a bit lower in the armpit. If a baby's temperature is 37.5 or more, it's considered significantly high. Now, when you've got twins, you can often tell right away if one baby is feverish because the skin can feel hot to touch compared with the other one. But of course, you need to use a thermometer to be sure. A fever tells you that something's wrong, and the cause is often an infection because fever is the body's normal response to infection. The snag is that a fever can be unpleasant for babies. It also dehydrates, and when temperature rises very fast, there's sometimes a risk of seizures. The peak age range for febrile fits is 6 months to 5 years. Babies are not good at regulating their own body temperature, so don't overdress a feverish baby. Take off a couple of layers to help lose excess heat. There's no need to sponge your baby down, and besides, babies actually hate it. To counteract dehydration, make sure your baby gets enough fluid. If you're fully breastfeeding, there's usually no need for extra water, but check this point with your doctor or health visitor. Liquid paracetamol is suitable for babies from the age of 3 months. It doesn't send a baby to sleep, but it does relieve pain and bring down temperature. Ibuprofen is also suitable for the same age group. It works in a different way to paracetamol, but it does much the same job. Whichever you decide to use, stick to the recommended dose. In some cases, you can give these drugs to younger babies, but only if your doctor or nurse advises it. Check your baby's temperature again around half an hour later, and once the fever's down, it makes sense to monitor the temperature every 2 to 3 hours or so until your baby seems better. When should you go to your GP or A&E? Well, it's impossible to list all the symptoms that need medical attention, but there are some very good reasons for going to the doctor. If there's a very high fever, over 38.5, if a baby's listless or unusually drowsy, if your baby cries and can't be consoled, if there's trouble breathing, if a baby's vomiting or has many loose stools, if the nappies are dry when you expect them to be wet. And of course, rely on your gut feelings too, because you are the one that knows your own children. As a rule, the younger your babies are, the more urgent it is. In most cases, your GP is the first port of call, but call an ambulance if your baby won't respond, stops breathing, or has a fit for the first time.